Heroes of History, Ben Carson, A Chance at Life by Janet and Geoff Benge. Chapter 11, The New Chief. Ben stepped off the airplane in Perth, Western Australia. It was winter in the Southern Hemisphere, but it was not like any winter's day he'd experienced in the United States. The sun was shining, and the temperature was 68 degrees Fahrenheit. Perth was the fourth largest city in Australia, and Ben liked what he saw. The city was nestled between the Swan River and the Indian Ocean. Parks and reserves abounded across the metropolis. Much to Ben's relief, the Australian people were warm and friendly. To Ben, it seemed like a desirable place to live, at least for the next year. Within days of arriving, Ben and Candy found a small house to rent in Nedlands, an area west of downtown. The house was located a few blocks from the Sir Charles Gardner Hospital and a nearby church. The Carsons visited the church and felt right at home. Members of the congregation treated them like long-lost family. Invitations to dinner flowed in, as did offers to help them set up a nursery for their soon-to-be-born baby. Ben and Candy were grateful for the outpouring of love and care. Ben soon got to work at the hospital. He was now 31 years old, but looked much younger. Because he knew it was difficult for some of the older surgeons to take him seriously, he waited for the right opportunity to show them what he could do. This did not take long. Less than a month after arriving, Ben was in a meeting. They were discussing a young female patient who had been diagnosed with a large acoustic neuroma, a benign tumor that grew at the base of the skull on the nerve connecting the ear to the brain. The tumor had the potential to cause deafness, a weakening of the facial muscles, and even paralysis. The chief neurosurgeon shook his head as he looked at the woman's x-rays. "This is one of the largest acoustic neuromas I've seen. No wonder she's in such pain. I've already spoken to her, and she understands that because of the tumor's size, it won't be possible to save her cranial nerves." As the chief surgeon spoke, Ben mentally ran through the surgical procedure. Any damage to the cranial nerves could have a large impact on the young woman. Ben spoke up. "Do you mind if I try to do this using a microscopic technique I've utilized at Johns Hopkins? If it's successful, I can possibly save the nerves." The chief surgeon gave Ben a skeptical look. "Go ahead. It's worth trying, I'm sure." Ben knew it was not good protocol to question a senior surgeon, let alone conduct the procedure his way. Yet, he believed he could perform the surgery with minimal nerve damage. "Thank you," he said to the chief surgeon. "I think we have a good chance at pulling it off." As Ben outlined how he proposed going about the surgery, he was aware that no one in the room really thought he could do it. Everyone expected him to fail and then fall into line as a resident who followed orders and did not question his elders. The following morning, Ben read several chapters from the book of Proverbs, as he always did, and prayed that God would guide his hands throughout the operation. The surgery took 10 hours, during which Ben used his full concentration. Staring into a surgical microscope hour after hour, he methodically removed the acoustic neuroma. When the surgery was complete, he was exhausted, but also elated. Ben had succeeded. The cranial nerves were in place and had suffered no damage. The young woman would make a full recovery. Although the senior surgeon did not say much to Ben, word around the hospital spread. Dr. Ben Carson could perform complex and risky surgeries. It was not long before surgeons began seeking Ben out and asking him to cover some particularly challenging surgery, such as the one he performed on Perth's fire chief. The fire chief had a large tumor that engulfed the major blood vessels around the anterior or front part of the base of his brain. The condition was challenging, and Ben had to operate on the man 3 times before he was able to remove the tumor entirely. It was major surgery, and it took a while for the fire chief to recover, but eventually he did make a full recovery. Ben loved the challenge of difficult surgical cases. He soon began to realize just how valuable his experience in Australia was. He was completing at least 3 times the number of craniotomies he would have done in an American hospital during the same period of time. During a craniotomy, Ben would cut through a patient's skull to remove blood clots and repair aneurysms in the brain. Soon he felt confident about doing many forms of complex brain surgery. At home, things were also going well. Candy remained healthy, and on September 12th, 1983, she gave birth to a baby boy. Ben and Candy gave him a thoroughly Australian name, Murray Nedlands, after the longest river in Australia and after the area of Perth in which they lived. As he looked down at his new son, Ben thought of how his own father had left him. There and then he promised Murray that he would be different. Ben would be a strong father, providing financial and emotional stability, and making sure the family had some fun along the way. For Ben, with a baby at home and plenty of challenging work at Sir Charles Gardner Hospital, the year in Australia flew by. It was time for the Carson family to return to the United States. Ben left Perth grateful for all the wonderful things that had happened while the family was there. A new son, lots of neurosurgical experience, new friends, and a church that had embraced them like long-lost kin. Even though Ben had worried about the racial issue when he first contemplated going to Australia, throughout his time in Perth, he had felt welcomed, accepted, and respected as a strong team member at the hospital. As the family headed back to the United States in mid-1984, Ben wondered what was next for him. Where would he work as a neurosurgeon? Would it be back at Johns Hopkins or at some other hospital? When Ben arrived home, the chief of surgery at Providence Hospital in Baltimore offered him a job. As Ben listened to the surgeon's pitch, he realized that the job offer made sense. Providence Hospital was situated on the south side of the city and served a mainly Black community. Knowing that Ben was interested in returning to Johns Hopkins, the chief questioned whether Ben would ever be promoted or appreciated there. Would anyone refer patients to him since he was Black and most of the hospital's patients were white? Ben understood where the chief of surgery was coming from, yet he had his doubts. He agreed that when he had been a resident at Johns Hopkins, some patients had looked down at him or even requested another surgeon, but the staff there had always been fair and appreciated his skills. The more Ben thought about it, the more he realized that he belonged at Johns Hopkins, a teaching hospital that experimented with new medical treatments and surgical approaches. That was the kind of medicine Ben liked. Besides, he had friends and mentors there who offered him good advice. Perhaps the color of his skin would become an issue, but he didn't think it would. Ben turned down the surgical position at Providence Hospital and headed back to Johns Hopkins. Ben soon realized that he had made the right decision. The staff warmly welcomed him back. The advances the hospital had made in the year Ben had been away impressed the young surgeon. By now, the hospital had an MRI machine. It felt good to Ben to be at an institution using the latest medical technology, especially in the area of brain surgery. A few months after Ben's return, an unexpected turn of events took place at the hospital. The chief of pediatric neurosurgery left to take a position at Brown University. Ben wondered who would be the new chief of pediatric neurosurgery. He was shocked when Dr. Donlin Long, chairman of the neurosurgery department, asked him if he would consider being nominated for the position. Ben went home to tell Candy, who was once again pregnant, about the possibility. He could hardly believe what he was about to tell her. At just 33 years of age, he was being nominated for one of the most prestigious positions in medicine, in charge of brain surgery on babies and children. Within weeks, the all-white board of Johns Hopkins accepted Dr. Long's recommendation that Ben become the new pediatric neurosurgery chief. Ben grinned from ear to ear when he heard the news. He resisted the urge to call the chief of surgery at Providence Hospital and tell him that he had not been treated poorly because of the color of his skin. For the next few days, Ben walked around in a cloud. By age 33, he had achieved more than many doctors dreamed possible in a lifetime. He found it hard to believe that the situation was real. There were times when it was also difficult for other people to believe it. Although the staff at the hospital knew Ben well, Ben often surprised the parents of sick children he was treating. He knew he looked young for his age. When people saw him, many of them assumed he was in his 20s, not even old enough to be out of medical school, let alone be a neurosurgeon. Sometimes Ben would sit and talk with parents who looked confused. "Who are you?" they would ask. "We would prefer to wait until Dr. Carson arrives so we can talk these things over with him." Or, "Young man, could you call Dr. Carson? I'm supposed to be meeting him here." Ben would chuckle at these moments and show the person his name tag. It did not bother him that people thought he was too young to be a neurosurgeon, not to mention the chief of pediatric neurosurgery at a prestigious hospital. Nor did it bother him that sometimes people were taken aback by the color of his skin. Whatever parents and grandparents might think of him, Ben knew he could help their children, even an extremely difficult case like that of a spunky 4-year-old girl named Miranda Francisco.